Hi, I'm Judy Meyer. This year marks the 23rd season of the Great Falls Forum, which is a monthly speaker series featuring leaders in the areas of business, public policy, academia, and the arts, and is done in partnership with Bates College, the Sun Journal, and the Lewiston Public Library. Thank you to those of you who are joining us on Zoom or Facebook today. A recording of the program will be available starting tomorrow on the library's YouTube page and also on the library's website. And just want to make sure you mark your calendar for February 18th for the next forum for Dr. Andrea Bro on the topics of lessons about race and place from Lewiston's teenagers. And more information is available on the library's website about that. Little housekeeping for today's program. Those on Zoom will see a Q&A option at the bottom of the screen. Use that to enter any questions for Dr. Shah today. For those joining us on Facebook Live, go ahead and type your questions in the comment box there, and we will share them with the panelists. Today, I have the pleasure of introducing our two panelists, Dr. Nirav Shah and Katie Boss. Counselor Boss is a public health professional and grant writer, today representing Androscoggin County's local public health nonprofit called Healthy Androscoggin. Throughout her public health career, she has focused on healthy housing, physical activity, nutrition, and food systems. She is a city councilor in Auburn, chair of the Auburn Agriculture Committee, and has served on the Good Food Council of Lewiston, Auburn for the last 3 years. Dr. Shah, who I'm quite sure most of you recognize now, was appointed the director of the Maine CDC in June of 2019. He came to Maine with a broad experience in public health, most recently as director of the Illinois Department of Public Health. As an attorney and public health economist, Dr. Shah previously advised professionals and governments around the nation and globe on improving the delivery of health care. He received both medical and law degrees from the University of Chicago and studied economics at Oxford University. Welcome again to the Great Falls Forum, and thank both of you for joining us. Our format is a little different for today's forum. Rather than a presentation from Dr. Shah, Katie will interview him for the first half, and then we will take questions from the floor. And we will keep this tight to our 11:45 end time to accommodate Dr. Shah's schedule. Thank you.
Excellent. Thank you so much, Judy, for that introduction. Thank you to the Lewiston Public Library, Sun Journal, and Bates College for hosting this really wonderful Great Falls Forum series. And thank you, Dr. Shah, for taking the time today to participate in this event. I want to thank you, Dr. Shah, and your team at the Maine CDC for all that you've done and continue to do for our state as we are tackling the greatest public health crisis of our lifetimes. And your leadership, professionalism, and your calm demeanor, despite what I can only imagine would be immense pressure, has been notable to us here in Maine and to many others across the country. So on that note, I would love to start off our event with a question from our audience that's coming from a longtime Lewiston High School debate coach, Joan Macri, who writes, "I've been impressed these many months with your ease in speaking in public. Your ability to take compound questions and answer them completely and efficiently, and to create compelling analogies seemingly off the cuff. Were you a debater or a public speaker in high school or in college?"
Well, first of all, Katie, thank you so much for inviting me, and thank you to the entire community for giving me the chance to chat with you today. I will answer that question in a moment because it makes me very happy and warm inside. But before I do that, on a somewhat personal note, libraries have a special place of importance for me, and I wanted to just take a second to thank the team, particularly the library community, for the invitation as well as the hosting of this forum. I like to say I basically grew up in a library. When I was a kid, we lived in a really small town in northern Wisconsin. My parents worked a lot, and so after school, most days I spent in the library. So I just have a great fondness for libraries, and I'm a big proponent and supporter of their role as not just a place where there is information, but a place for kids like me to go. So it's very, very meaningful for me to be able to talk to a library community like this. As to the question, it's a question that gives me a great sense of joy, because as the questioner intuited, I have spent much of my academic career in starting as a sixth grader being involved in speech and debate. I was lucky enough to go to a middle school that offered that, as well as a high school that had a well-regarded program. And so starting as a sixth grader, I started with public speaking and debate, something I carried through not just from middle school, but through high school at a competitive level, and then in college at a competitive level, and then even in graduate school at Oxford, where I was a member of the Oxford University debate team. So I say all that to emphasize one really important point for folks who might be watching who are younger folks, who are high school and middle school and even college age kids. There are, to this day, 2 skills that I learned in school that are useful to me every single day. And the first of those, by far, the most important of them, were the skills that I learned in high school, college, and graduate school debate. The ability to think on the fly, as the questioner noted, the ability to disagree with precision and tact, and the ability to persuade folks who may or may not believe with what you're saying, as well as the ability to see all sides of an issue. That is one of the most, actually I will say the most indispensable skill sets that any young person can develop. It comes from drawing on multiple areas of classical literature, rhetoric, logic, politics, economics, science, and bringing it all together to be able to communicate. Those are not skills that anyone is born with. They are skills that are learned and developed through coaching, through debating, through practicing, through losing, and getting better. And debate is one of the 2 most foundational skills that taught me, that I draw upon every single day. The other being being good at math. Being able to problem solve is the other skill that you learn. But debate is foundational for everything I do. I owe several debt of gratitudes to the debate coaches that I had, starting way back in 6th grade with Mrs. Bell, who was my first debate coach. So it was, has been, and continues to be a major part of my life. I am gratified that the questioner picked up on my debate training, because it's a big part of why I'm able to talk to folks about what's going on in difficult times with COVID.
That is great. I love that. And thank you for sharing that story. Great job, Joan, on picking up on that skill. And also, Dr. Shah, it's very inspiring to hear you speak. So thank you for sharing that. So jumping right into COVID-19, it's very exciting to see vaccines start to roll out across the country. We have a question here that says, how should we as a community be talking about the COVID-19 vaccine? What common fears do you hear from residents about the vaccine, and how will Maine CDC be communicating to the public about the vaccine's safety and distribution?
Great. Let's talk about how to talk about the vaccine. What I try to do when I talk about the vaccine is to focus on the positive. It's what I've tried to do throughout the pandemic. Let's focus on what the vaccine can do and why it's important right now. We have all been traveling through a very long, dark, and sometimes seemingly endless tunnel. And the vaccine represents a light at the end of that tunnel, albeit one that is still, for many Maine people, a ways away. When I think about the vaccine and what I want folks to see about it and appreciate about it, comes down to one word, which is confidence. Confidence in the vaccine and confidence in the vaccination process. The vaccine alone is wonderful, but a vaccine in and of itself doesn't save anybody. It's the vaccination that saves folks. So when I think about the vaccine, I think about confidence at the end of the day. We are trying to educate folks with the facts around the vaccine to generate confidence in the vaccine and the process by which we hope to deliver it. Right now in Maine, the demand for the vaccine far outstrips the supply we have. We hope that that will change in the near future, such that we will be able to saturate all the various channels, whether that be the pharmacy, your doctor's office, hospitals, and others, with as much vaccine as we are getting in. Unfortunately, right now, there is that supply constraint. The main fears that I hear about the vaccine are, one, wasn't this vaccine rushed? I thought vaccines take decades to develop. How did we develop this one in a year? something I've talked about previously, and I'm happy to get folks information on why I don't think the vaccine was rushed. Indeed, it was prioritized. And there's a difference between those two. The other main concern that I hear from folks is not so much whether the vaccine is a good idea, but when they will get vaccinated. I know right now that everyone in Maine wants nothing more than to know the exact date and time on the calendar that they can and will be vaccinated. And I want nothing more than to be able to give that to you. But right now, supply is our constraint on speed. As soon as we start getting more vaccine in the state, I promise we will get it out the door and hope to work with providers to get it into people's arms.
That's great. I know that's a big question that everybody has on their mind, that timeline and where they fit into it. Can you explain the recent challenges with receiving vaccine doses that haven't been kept at the correct temperature and why temperature is so critical for this vaccine in particular?
Absolutely, Katie. I'm actually going to talk about in just a couple minutes from now with the media around what we've learned. But these vaccines, the two that are that have been authorized thus far, one from Pfizer and another from a company called Moderna. Both of them require the vaccine to be kept frozen at varying degrees of frozenness. The Pfizer one, for example, needs to be ultra cold, minus 80 degrees. The Moderna one can be kept in your regular old kitchen freezer. The reason why both of those need to be kept in cold temperatures is because of the molecules that are used to generate the body's immune response. And those molecules they do not degrade when they are kept in that frozen environment. They can be taken out and utilized in a clinic, but they've got a limited span outside of a frozen environment. Indeed, in recent days, Maine just received a shipment of vaccine that was not kept within the proper temperature parameters. Thankfully, we are learning that, if anything, the vaccine was too cold, which means that those doses may in fact be able to be utilized. That's a great sign, but we're still waiting for confirmation of that from the US CDC. There are also vaccines that are on the horizon, that are in development right now, that do not require this ultra cold storage environment. That will be a significant boost for us because it means we can distribute vaccine to places that may not have those ultra cold storage freezer units.
That's great. So when somebody receives both doses of their vaccine, what sort of risks can they then take after receiving the vaccine, and what precautions should they continue to take?
I like the way you frame that because it's a balance of risks and precautions at the same time. So let's start with what doesn't or shouldn't change after you've received both doses of your vaccine. And right now, based on where we are and what we know today, January 21st, we still recommend that even after you've gotten both doses, you still practice what has become standard good public health protocol. Wear a mask, stay physically distant, avoid crowds. Now, why is that? You might say, wait a minute, if this vaccine is our ticket out of this pandemic, why do I still need to wear a mask? Well, there's a couple of reasons. One is that even after you've gotten both doses, the vaccine can take a little bit of time to be fully active, maybe up to 2 weeks, maybe even longer. Another reason is that a lot of businesses still require you, per Governor Mills's orders, to wear a mask when you're indoors. And it's difficult to know who's been vaccinated and who hasn't been vaccinated. And we want, until there is widespread vaccination, we want uniformity. And that's another reason why mask wearing will still be with us, even after folks have been vaccinated. I know that sounds strange, but that's where we are. Now, in terms of additional things folks can do, the vaccines that we've got right now are tremendous scientific breakthroughs. They reduce the likelihood of getting COVID by 95%. And that does mean after you've been vaccinated, if you're an older Mainer with your grandkids, you should feel free to hug your grandkids again and engage with your family in ways that we know so many people have had to put on hold for a year. And that just speaks to the tremendous scientific advance these vaccines represent.
That really struck me when you said that grandparents can feel comfortable hugging their grandkids again, because we are living that experience right now with our parents and our kids, and it's unbelievably hard. But thank you for that additional information about how to stay safe even after vaccination.
They should all still be masked, though.
Still be
wear a
masked.
mask.
Absolutely.
Yes,
absolutely. So here is a question from Lewiston resident and mom of a school-age child named, her name is Missy North Drain, and she asks, do you foresee employers requiring employees to get the COVID-19 vaccine? Do you also foresee schools to require students to get this vaccine? And if so, do you think it will be required by the September 30th, 2021 date when the new vaccine requirement law goes into effect?
Great. Well, Missy, thanks for that question. Let's talk about employers first. The answer actually to both is that I don't know. With respect to employers, that's going to be a discussion and a conversation between any particular employer and their own employees. There are benefits and drawbacks of that approach. The benefit, of course, is that having everyone required to be vaccinated can keep the workplace safe. But right now, where we are in the initial stages, my view is that it's a bit early to be asking or making decisions around those questions. It's the right time to ask them, but deciding upon them is a bit early. We still need to focus on getting vaccine out to everybody. We also know that there are folks who have concerns around the vaccine, for whom confidence in the vaccine is not where we hope it will get to. You have an interesting dynamic if something is being required of you if you don't really quite feel that it's the right thing for you. My general approach is that it's better to start with education to inspire confidence. But again, this is going to be a national conversation that's going to happen across the country as we move through this year. And I right now don't have the final answer or even some of the beginnings of the answers. Schools are similar. Right now, only one of the vaccines is authorized for individuals 16 and up. So right now, neither of the vaccines is even authorized by the FDA for school-age children, the vast majority of school-age children. And that's because we want to do studies to make sure we know it's safe. We believe it to be safe based on everything we've seen about the vaccines, but believing something to be safe and proving it via science are two different things. Those studies are underway right now. If or when the US FDA authorizes both or additional vaccines for school-age children, that's when that question will come into sharper focus. And as it relates to this year's deadline for kids to have all their vaccines on board, I think, again, right now, we need to have the data before we know what that'll mean for the COVID vaccine.
Thanks for that answer, and thank you, Missy, for that question. So part of today's event, we're talking about vaccination, we're also talking about mental health, and we're talking about the new year. So I wanted to ask, what are your thoughts on COVID's impact on mental health and how that relates to calls to reopen communities as a method of improving mental health? What measures can communities take to address the critical public health issue of mental health during this time?
Well, Katie, I really am glad to be able to talk about this because this has been a concern of ours at the state level, at the national level, amongst my counterparts in the other 49 states since the early days of the pandemic. And the mental health impacts, the bottom line is that for many people, for many communities, it's been extremely difficult, if not downright unbearable. And we shouldn't shy away from that. We should acknowledge that the pandemic, the need to be socially distanced, physically distanced, has meant for many people, they've been mentally distant. And they haven't connected with their friends, neighbors, family members in the same way. We talked about grandparents a little while ago. For some communities, that's even more magnified. And for individuals who are already grappling with mental and behavioral health challenges, be they substance abuse or others, the pandemic has only made those challenges harder. We take those considerations into mind as we are thinking about what is best from a pandemic perspective. We try not to think about things like closures in a vacuum and just look singularly at the virus. We take into account the mental health impacts as well as the societal impacts. If you work at a restaurant that has its doors shuttered, that means that you're out of a job. And so we're not, and thus are at greater risk for not just COVID, but mental health challenges. So we don't make these decisions in a vacuum. We try to balance all of these considerations. Doing so is incredibly difficult, as one can imagine, because of how quickly the pandemic has changed. What I would offer to communities that are themselves grappling with this balance is to recognize that the answers are very difficult. But where we have landed is to focus on getting through COVID focus on keeping people safe, because the sooner that we can get through COVID without experiencing the flares that, say, California is experiencing right now, the sooner that we will all be able to get back to that return to normalcy that we all crave. The balance is not easy. There's no question about it. But the sooner we can move through COVID, the sooner we can get back to that way of life that we were at before.
Absolutely. Thank you. So, what other pressing health issues besides COVID are most concerning to you right now?
Well, that question, Katie, is the perfect companion to the prior question, because it's important to recognize that although COVID is what has dominated our lives over the past year, other health issues haven't gone away. So mental health remains a challenge. And again, let's acknowledge that for many people, many communities, COVID has exacerbated mental and behavioral health challenges. Substance use issues have not gone away. Other pressing public health matters have not gone away. Food insecurity remains a challenge. Childhood lead poisoning in the Lewiston, Auburn area remains a significant challenge. Those issues have not gone away. They remain top of mind. We have been trying simultaneously to forge a new pathway with respect to COVID, while also making sure as to not lose sight of these other public health challenges. There are also challenges that we know are looming with respect to folks who have delayed or deferred primary or preventive health care. We want folks to go out and visit their doctor. If you haven't been to your doctor this year, haven't gotten that mammogram or colonoscopy or other recommended preventive health care, I strongly urge you to do so. We're also worried that childhood vaccination rates may have dropped because of parents wanting to avoid the doctor's office. Now is a great time, as we're all talking about vaccinations, to make sure your family and your kids' vaccines are up to date. The health problems of before the pandemic haven't gone away, and as we resume the normalcy of society, they're going to return as being front and center.
Thank you for that, Dr. Shah. I would love to take a minute and look at our Q&A box to see there's a lot of questions that have come in, which is really lovely. So here is a question from Heather on Facebook. She's asking, do you recommend the vaccine for people who have an autoimmune disease?
So as of right now, Heather, there is no contraindication to getting the vaccine if you have an autoimmune disease. But there are numerous types of autoimmune diseases. The spectrum of autoimmune diseases is very wide-ranging, as you know. And so what I recommend is that if you do have an autoimmune disease, you check in with your clinician, your rheumatologist, your healthcare provider on when and whether a vaccine should be administered. There is no reason not to be vaccinated, but given the range of autoimmune conditions that are out there, my recommendation is that you check in with whatever physician is principally responsible for caring for your autoimmune condition. There is no reason not to be, but it's also a good reason to check.
Great, thank you. And here's another question from Facebook from Eric. And Eric is asking, does the Maine CDC do any analytics on disparities in testing or in vaccinations? For example, any disparities on race, age, or income?
We do look at those. With respect to vaccines or vaccination, it's a bit early to have seen any defined trends in who has received vaccine along some of the socioeconomic, racial, and ethnic lines that we mentioned. And that's partly because up until now, the bulk of whom we have offered vaccine to have been, for example, defined discrete groups, healthcare providers, EMS clinicians, so on and so forth. So it's a bit early to try to get a sense of what might be happening because we haven't really expanded vaccination efforts only just in the past 72 hours to a broader swath of the population. With respect to testing, we have looked at those metrics. I don't have the latest analysis. I know that we try to update that analysis from time to time. I don't have the latest analysis in front of me, but I do know that we look at who is being tested so we can get a sense of whether the right folks are being tested.
That's great, thank you. Another question that's coming in, lots of great questions in here. There's one that says, If you have already had COVID, is it okay to still get the vaccine?
The answer is yes. In fact, the US CDC and Maine CDC recommend that even if you have had COVID and have recovered, you do get the vaccine. There are a number of reasons for that, which there are many of the scientific and immunological reasons, but the bottom line is that the scientists who are experts in vaccines and infectious diseases do recommend that even if you've had COVID, getting the vaccine is still a good idea.
Great. That is great to know. And another question similar, does the vaccine prevent vaccinated people from spreading COVID-19, or is it only protective to the individual?
Based on everything we know about vaccines, infectious diseases, and virology, we have every reason to believe that someone who is fully vaccinated, so weeks after their second dose, will not just be prevented or protected against getting COVID, but also around transmitting COVID if they happen to have harbored the virus in their body. There are studies underway right now to demonstrate that with more scientific rigor, and those studies are being done. It would be a very surprising finding if it turned out that the COVID vaccine protected you from getting sick, but did not prevent you from spreading it. Indeed, according to one infectious disease expert I spoke with, it would be the only vaccine in the world that is known that didn't protect you against both. So we have every reason to believe that it will do both. But as with so many things in science, there's believing something and knowing something. Until the studies are in, we believe it very, very strongly, and I hope in the very near future we'll also know it.
That's great, thank you. So we have another attendee who has a question about really looking at the population level when we're talking about vaccinations, not just the individual. And they are asking, how do we get back to normal life when such a massive amount of the population won't get vaccinated? What do we do about healthcare workers who are not interested or refuse to get vaccinated?
Well, let's first note that we don't really know what the eventual percentage of the population that is willing to be vaccinated will be. And in recent months, the percentage according to surveys, which is different from folks who have a dose right in front of them, but the percentage of folks in surveys who have indicated a willingness to be vaccinated has varied from as low as 30% some weeks up to 65%, in one survey recently 78%. We don't really know what the ultimate numbers of uptake and hesitancy will be. But let's acknowledge, though, that that number is changeable based on the survey data that I mentioned, and that with thoughtful, fact-based education, we have a good chance of making sure that people are confident in the vaccine. So what should we do about that? Well, here is what I think is really important. I think it's important that we approach this, to go back to the first question, that we approach this not like it were a high school debate, right? The focus of high school debate is to spew out as many facts as possible so you can win as many points as you can against your opponent and hopefully convince a neutral judge that you were smarter, faster, better, and right. That's the focus of high school debate. And all too often nowadays, we treat disagreements between ourselves and another person as a high school debate. We meet with somebody on the street or in our families who doesn't see the world we do. And our immediate response is to say, well, that's just wrong because this, and this. And how can you possibly not believe me? My view is that in the history of recorded thought, treating conversations like high school debate has never, ever changed a single mind. Indeed, all it has ever done is reinforce people's opinions in the first place. The only way that we will move toward broader, widespread acceptance of vaccine is not by trying to out-debate the person who doesn't believe it, but by asking them, what are their concerns? What are the sources of information upon which they are relying? What would it take for them to be vaccinated? That's an actual conversation as opposed to a debate. That is going to be the only way that we get people on our side.
It's a great reminder at a really critical time. Thank you for that. So lots of great questions still coming in through this Q&A box. So thank you everyone for your questions. There's a theme that I'm seeing. A lot of people are asking about, will it really be June before healthy folks under a certain age will have vaccines? What do you see looking ahead for availability of vaccines, kind of looking at the into the looking glass, if you will? So what are you seeing down the line for vaccination schedule? And more broadly, people are asking about the course of the pandemic.
Sure. Well, let me first acknowledge that what I'm going to do is a very dangerous thing, which is to speculate. And so I am. My crystal ball is no better than really anyone else's out there. So I'm going to just offer some possibilities based on potential trajectories that could happen. None of these will probably be true, but that's the danger with speculating. At the same time, we owe it to ourselves, and I owe it to you, to at least talk about what I see on the horizon, recognizing that it may not be perfect information. I will say right off at the top, I've been disappointed in the supply of vaccines that have been pushed out, not just to Maine, but to all other 49 states. Last week, we got the same amount of vaccine that we're getting this week. And next week, we're going to get pretty much the same amount of vaccine that we're getting this week, which is about 18,000 doses for all of Maine every week. That's it. That's dismaying, and we all wish it were faster. I have had pointed conversations with officials at the federal level who are overseeing the vaccine production, and they have indicated that that flat vaccine level is likely to persist for several more weeks. I have also asked them, after those several weeks are up, what does it look like then? Is it a single digit percentage increase? The double digits? When are we going to start getting vaccine into our state in sufficient quantities that we can start furnishing it to pharmacies, doctors' offices? Everywhere that you go will have a vaccine. When is that going to happen? The answer is that they don't know. And so as a result, we are left trying to plan without having any sense of what the future pipeline looks like. The closest that I have heard toward viable projections has come from one of the general who operates Operation Warp Speed, who has indicated that it won't be until the spring before the supply chain increases. And that's why, Katie, I have told people in Maine, as much as it pains me, that it could be into the spring and definitely potentially into the summer before a vaccine is available in widespread quantities across the state. What that means is that for many people, many Maine people who are younger and healthy, don't have other health conditions, and who may not be working in a frontline position, it could be late summer or early fall before a vaccine is available. I wish that weren't the case. Again, I wish I could give folks a date and time on the calendar. But right now, we at the state level don't have any visibility more than 6 days in advance about what we'll be seeing in the future. The course of the pandemic will in part be determined by the course of vaccination. We can all keep doing what we can doing, masking, physical distancing, avoiding crowds, which is the number one thing you can do right now to keep our numbers as low as possible, but our numbers are concerning. Today, on the day I'm speaking with you, we've had 600 cases of COVID just today, 5 new deaths. So while you're waiting for a vaccine, there is one thing you can do today, and that is to wear a mask anytime you are interacting with somebody who's not in your household. When you're outside, when you're at the grocery store, when you're at work, you're interacting with someone who's not in your household, wearing a mask is the single best thing you can do today.
Thank you, Dr. Shah. That's a great reminder for everybody. And taking us down that path of looking into the future, what's giving you hope from a public health perspective or otherwise as we're looking ahead into this new year?
Well, you know, in this world right now, today, unless you've got hope, unless you're an optimist, it's difficult to get through the day. And I am, at my core, an optimist. I always have believed that even the events of the past 365 days notwithstanding, I think the world is still has the potential to become a better place every day. And that's what I try to do every single day. I try to make myself a better person than I was yesterday. I try to make the Maine CDC a better agency than it was yesterday, and hopefully a better agency tomorrow than it was today. What gives me hope right now are a few things. The first is that notwithstanding the challenges that we've had in getting vaccine supply into the state, the uptake of the vaccine in Maine has been robust. We've worked and planned for months to make sure that when doses come in, we get them straight to the people who can administer them. So that's great. Uptake has been robust, and I hope that we can see that continue. I've also seen that across the state, public health means something. Science means something in Maine. Is mask wearing 100% everywhere? No. Seatbelt wearing isn't 100% everywhere. These things take time. But the question in my mind, the mantra that I try to keep in mind is progress, not perfection. Every single day, we're making and showing signs of progress. We're getting better at vaccinating long-term care facilities. We're getting better at encouraging healthcare providers to get vaccinated. We're getting more and more folks across Maine to buy into wearing a face covering. So what gives me hope is that we are continuing to see signs of progress. Progress should be our goal, not perfection.
That is a great reminder. I love that phrase, progress, not perfection. It sounds like it should be on a t-shirt or a mug. And along those lines, I have a great question in here from the Q&A box from John. And he's asking, are you now recognized in the general public, and what do you feel about being a CDC rock star? Your name was not a household name, yet you now have t-shirts and coffee mugs.
Well, John, let me first start by noting how gratifying it is, right? My family and I have lived in Maine for a year and a half. We moved here in June of 2019, 6 months before the pandemic started. And it's incredibly gratifying to know that people across Maine, from Fort Kent to Elliott, from west to east, have come to find what Maine CDC does as a source of trustworthy and reliable information. I've said before, and I will say again, I think that speaks more to the character of Maine people than it does about me. But I also would be remiss if I didn't note that I'm just the guy who talks, right? The reason I am able 3 times a week or during this session to talk about what's happening with COVID and vaccines and our planning is because I've got a team of 300 or 400 people who are working 24/7 to do the work that I get the privilege of talking about. And so, as gratifying as it is to see the warm reception, those T-shirts should really not have my picture on them. They should have a picture of the Maine CDC building on it, because that's where the work is really happening. So it's gratifying, make no mistake, but I just ask everyone to keep in mind that I'm just the guy who's able to talk about all the work that people up and down in every floor of this building that I'm in are really doing. So I appreciate that question, and it's my team that does the work.
There's a lot of heart and a lot of hard work coming out of that building, and I'm really grateful to know all the folks at the CDC that I do know and everyone who works there. So I believe we have time for one last question. It's a question that I've been holding on to for a long time now, and I'd love to have the opportunity, or take the opportunity now, to ask you. So a little bit of a Likert scale. On a scale of 1 to 10, how good did it feel to simultaneously Rickroll the entire state of Maine? And where did you get your propensity for quoting song lyrics? And for those, I'll just say, for those who don't know what Rickrolling is, it's a prank involving an unexpected appearance of the music video or song lyrics for the 1987 Rick Astley song, Never Gonna Give You Up, which Dr. Shah recited flawlessly in the middle of a news briefing in September without even cracking a smile.
Well, I'll crack a smile now because sufficient time has passed. And, Katie, So let me answer a slightly different question, which is why do I, what's the deal with hijinks like that, right? Why do I do that? And because I've gotten some negative feedback. I've gotten folks who say I'm downplaying, I'm not taking the pandemic seriously enough. Let me say two things. The first is I tell my team every day that the work we do, the work all of us do facing a pandemic across the state, the work that every single one of you is facing, it's a downer. But that doesn't mean that we have to be morose all the time. We can find joy and levity even in the darkest moments. The other thing though, and so I try to do that. When I talk to the media, when I talk to Maine people about the pandemic, generally speaking, the news is not good. People have died. People are sick. People are struggling. They're in the hospital. They're on a ventilator. The news is bad. But if we lose sight of what makes us smile, then we've lost that optimism that I talked about a moment ago. If everything is bad without even a glimmer of hope, it's difficult to get folks to buy into why the future matters, why wearing a mask matters, why staying physically distant matters. And the way that I try to do that is to use a little bit of levity as a bridge. There's a time for levity and there's a time for seriousness. And I try to balance those two while always being respectful. The other thing, though, is that when I talk to Maine people about COVID, I want to let them know what the facts are because I always want to be transparent. But I also want to impart to them things they can do every single day to keep themselves and their families safe. And if I can do so by attaching it to a memorable song lyric or a quote that we all know or an analogy that resonates, then I haven't just talked to folks, but I've actually communicated something that may resonate with them throughout the course of their day, their week, their year. Again, my job in all of this is not just to read off a litany of numbers. Anyone can do that. My goal here is to empower folks with the facts so you can take steps to keep yourself safe. And if I can do so with a song lyric that we all know or an analogy that really hits home, then I haven't just talked at you, I've actually communicated with you, and that is my goal.
Thank you so much, Dr. Shah. We really appreciate your time. It was an honor to spend this time with you, and thanks for being such an inspiration in so many ways.
It has been my honor, and sorry, Judy, but I just got to say it again, not apropos to this conversation, but I just can't thank the library enough. Libraries are such an important part of our communities and our democracy. Thank you. Thank you for the opportunity as well as for the work that you are doing to bring this forum and this series to life.
Well, it's really wonderful to leave on a hopeful message, and we really appreciate your participation today, Dr. Shah and Katie, both of you. Thank you very much. People have joined us, and we'll see you next month.
Thank you all.
Thank you.